Hey teams, Lauren here with Bizrok. In this week's video, I want to talk to you about unscheduled treatment and how do we track that? How do we follow up with that? Guys, there's such a wonderful and beautiful thing that happens whenever we follow up with patients who haven't given us a yes or move forward or scheduled to do treatment with us, okay? Oftentimes though, we see it as a huge missed opportunity. We get defeated because the patient, the clinical team, they do everything that they're supposed to, and we present the financial options, and the patient maybe even didn't ask a lot of questions, and maybe the patient says, let me think about it, let me follow up with you, let me speak with my spouse, but we don't have a follow-up process to actually keep in contact with that patient, and so we tell ourselves a story, we're like, oh, they got busy, they thought it was too expensive, they can't do it. Guys, we think about dentistry at least 8 hours a day whenever we're at the work, or hopefully we are, right? But our patients, the second they walk out the door, guys, they've got 100 other things going on. And so calling the dental office back is always not a top priority, okay? So I know that we've had videos previously on route slips, okay? And I don't mean to beat you up with route slips. Guys, we love route slips. Why? They're functional and they work, okay? And specifically, I love a paper copy because I like it as a multi-use. So if you've done training with us before, if you've watched some of our videos, you know that one of the very first uses of a route slip is morning huddle prep, because you write specific notes on there about the patient. It reminds you about outstanding treatment, anniversaries, birthdays, important things, like all this stuff, maybe even family member appointments that need to be scheduled, okay? So that's step one. Two, it tells you everything that's gonna be done that day. If you make changes to it, you cross it out and you write it off to the side. If the patient has to come back in for treatment, you should write down on the route slip, what they need to come back for, who's the doctor or provider they're gonna see, how many units. Guys, that's already 3 different uses for the route slip, and we haven't even gotten to the treatment tracker, okay? So when a patient comes in, yes, we use it for the handoff, so the front office team knows exactly what was done and what the patient's coming back in for. But if the patient doesn't move forward, they don't schedule to come back and see us right away. They say, hey, I'll call you back. Let me speak to my husband. I'm going out of town for the next month. Let me schedule when I get back. Whatever it is, guys, that route slip becomes a treatment tracker for your office, a follow-up system. So while I do love digital, when it comes to tracking unscheduled treatment, guys, I love good old-fashioned paper. Why? Because it creates top of mind awareness and it allows us to actually focus on it on a daily basis. So do this for me. I want you to imagine a binder, okay? So we have a small binder and there's tabs in there that are 1 through 31. 1 through 31 should represent the days in a month. Why 31? Because the most that we could have are 31 days in a month. So you can buy that tab set 1 through 31 and just stick it in the binder. Now follow me on this, okay? Pretend today is the first of whatever month. My patient comes in, they present treatment in the back. The patient says, hey, I'm gonna give you a call back. So they don't schedule, right? If I am that checkout coordinator, I am gonna take that route slip and I'm gonna do I'm gonna write 2-day and a line, okay? So today's the first. I'm gonna take that treatment tracker and I'm gonna put it into the 3rd of the month. And then on the 3rd of the month, I'm gonna pull that treatment plan out and be like, oh yeah, I need to call my patient. So today is now 1/3 of 2022, whatever it is, right? So on the 3rd, I'm gonna call my patient. Hey, Susie patient, this is Lauren from Dr. So-and-so's office. I know that you wanted to speak with your husband about this type of work that you wanted to get done or that Dr. Smith recommended for you. I was just doing a personal follow-up. He asked me to reach back out to you to see what questions you have before you move forward. Now, there's a few things that happens during that call. One, I'm giving authority back to my doctor. The doctor personally asked me to give you a call. This doctor recommended this treatment plan for you. What clinical questions do you have before you move forward? Before you move forward is specific verbiage, guys, that implies that the patient's moving forward. The question is just when, okay? So remember I said, that's on the 3rd of the month. So I go to the 3rd, today's the 3rd day of the month, I pull that treatment, I call the patient, maybe I leave them a message. I'm not done yet, okay? See, what you guys may not know, and I try not to use the word sales in the dental office because I know the type of connotation it has and nobody likes the word in sales, but hang with me for a second. In the sales world, on average, it takes 5 times before somebody will move forward. Guys, what if that's true in the dental office? What if that's actually true for us and we're not following up with our patients enough? Like, we have this fear of rejection. You know, sometimes it's said that public speaking is not the biggest fear for people. It's usually the fear of rejection. One of those are always first or second, and they usually kind of go back and forth between what's the most or the biggest fear for Americans. Guys, we're so fearful of rejection that we tell ourselves stories and we're like, I don't want to bother the patient. I don't want to overwhelm them. They told me they'll call me back. Guys, have you ever told somebody that you'd call them back and then you forgot? Guys, we're human, right? And again, we're not thinking about dentistry 24/7. And so sometimes we forget. I would argue we're doing ourselves a disservice and we're not serving our patients if we're not following up with them, okay? So on the 3rd, I leave a voicemail for my patient. Now, I'm gonna write a 7 below that too, and then I'm gonna move that patient route slip to 1 week out, okay? So today, if today was the 3rd, I had to leave a voicemail for my patient, then I'm gonna go 1 week out, which simple math would be 10. So now I'm gonna go to the 10th of the month, and then on the 10th day of that month, let's say it was January, so January 10th of that month, I'm gonna open up on the 10th day and say, oh, I've got some route slips. So now I'm gonna pull that route slip out and then I'm gonna call my patient again, okay? Guys, this is only the 2nd time that you've called the patient, and it's a week out from the first time that you ever called them, okay? Again, if you leave a voicemail, great, write a note. So 7 days on 1/7/25, left message for patient. And then also please document it. Remember, our rule is if it's not documented, it didn't happen. And I want everything documented. I want text messages, emails, phone calls, voicemails, every conversation in the back. Why? It protects the practice and it gets everyone in the habit of always, always, always documenting and note-taking properly, okay? So same thing, the patient doesn't answer for whatever reason. Now I want you to take that same route slip and I want you to put it out 2 weeks later. Okay, so remember originally we were on the 10th day of the month, we were calling our patient, following up with them on treatment. So now we're gonna go 2 full weeks out from that date. So 10 plus 14 days, so 2 weeks, that would now be on the 24th, okay? So we're gonna go to the 24th, and the 24th of the month, we're gonna pull that route slip out and we're gonna go through the same thing. And I know for some of you, you're like, oh my gosh, I'm following up with my patient so many times. Remember what I told you about in the sales world, on average, it takes about 5 different times. And the study is actually 85% of all sales comes from a 5th follow-up. Guys, what if that's half true? Docs, I don't know if you're watching this video or not, but if that's half true, I'm wanting my team to follow up on unscheduled treatment. Why? Because there are missed opportunities when we're not following up with our patients, okay? So don't do them a disservice, okay? At that 2-week mark, we do that final phone call, and here's the last step in that process, okay? After the 2-week phone call, maybe we do a voicemail. This is where it's a change in our process. If we still don't hear from the patient and we have to leave another message, I want you to send a letter to the patient. And docs, this is where I need your help and I need you to get involved. You should create a generic letter to the patient where you can easily edit and change the date, the patient's name, the doctor, and the services. So we can create a generic letter. Guys, if you don't have this, reach out to our team. We can provide this for you. It should be uploaded to your Google Doc. If not, reach out to us and we'll give that to you. But it should be a generic letter where it's like, hey, Susie patient, I just want to personally follow up with you. I know you were in earlier this month and we talked about moving forward with whatever. I just wanted to personally check in on you. I saw that you haven't gotten back on my schedule. I truly care about you and I want to make sure this is taken care of as soon as possible. Please give us a call if you have any other clinical questions. Otherwise, I look forward to seeing you soon. Guys, that's it. That's the letter. And you put it in the mail and you document that sent Dr. treatment letter or outstanding treatment letter to patient on this day. That's all you do. Now, once that letter goes out, you take that route slip that formerly was our treatment tracker and you go ahead and you shred it, or for some of our offices, they will upload it to the patient's like Smart Doc so that we have it as a tracker so that we know that we did all of those things, but you shred it and you move on. Guys, the reason I love this binder and I love shredding those after I'm done doing all of my touch points with the patient is so that I have a clean binder of the most recent outstanding unscheduled treatment, okay? It allows you to stay top of mind for the patients who've recently come in. So If you need help, reach out to our team. We'd love to help you. We'd love to serve in any way, guys. But this is such an amazing process that truly, truly works. Plus, it allows anybody to jump onto the treatment tracker and start following up with patients to get them back in to see you guys. If you need anything, reach out to us. Otherwise, guys, we can't wait to see you and serve you soon.